Edible to prevent, dangerous to ignore. That's how the National Meningitis Association describes meningitis, a deadly infection that affects the protective membranes covering the brain and spinal cord. Be it bacteria or viral, the two most common forms of meningitis, the disease which comes with high fever, severe headache, vomiting and irritability, can affect any age group, from newborns to the elderly. Nigeria, on the meningitis belt of sub-Saharan Africa, covering Senegal to East Africa, has had its share of the epidemic with grave consequences. The current deadly outbreak is taking hold of a large chunk of Nigeria's poorest region, and in a very rare form, the type C, with little or no vaccines readily available. The situation is equally compounded by the 2017 rainfall prediction of the Nigeria Meteorological Agency of a prolonged dry season with attendant agricultural and health challenges. With the consequences of these already evident, the date's edition of Dateline 360 zeros on the current meningitis outbreak, efforts at containing it, and the role of all parties. Welcome. I'm Hauwa Salihu Adama. It's good to have you rejoin us on Dateline 360 this week as we take a closer look at the devastating presentation of meningitis, living death, and its trail in some parts of Nigeria. Rabi Abdullah, with our lead report, will now take us through the current outbreak with a twist likely to be amongst the worst so far, and efforts towards protection and rescue of victims.
Cerebrospinal meningitis, the deadly disease called Sankaro, by the Hausa-speaking people of northern Nigeria, where it mostly occurs due to factors such as the heat from the scorching sun, poor ventilation, and poor hygiene.
Meningitis simply means inflammation of the meninges. Now, the meninges are the covering or the blankets which cover the brain and prevent it from being moved around too much. The signs and symptoms of meningitis are pretty much sort of like that of malaria. So within 1 to 10 days, but usually within 2 to 7 days of coming into contact with the organism, you would start having headache, then there will be fever, then neck stiffness.
1996 recorded one of the worst outbreaks where several thousands of lives were lost. Other outbreaks occurred in 2003, 2008, and 2009 with attendant mortality. Cerebrospinal meningitis is said to have up to 12 serotypes. Before now, the serotype A of the disease had been the common one the country had to deal with, and the populace often get immunized against it. The current outbreak is that of serotype C.
We have only vaccine for A, and then now C came out, so they have to go and they actually request WHO to give us a stock of C, and they gave 500,000 doses of A and C to this country, and they distributed it to all other serious states that are having serious outbreak, like the 5 states.
The Center for Disease Control has confirmed the outbreak in 5 states, with at least 489 deaths already, while about 4,637 suspected cases have been recorded out of 207 fully confirmed cases. Zamfara State has the highest number of cases. Next to it is Katsina, followed by Sokoto. Others are Kebbi and Niger, while Abuja, the Federal Capital Territory, has also recorded 6 deaths from 8 suspected cases. Bauchi has also confirmed 2 cases as at the time of filing this report. Regardless of the rejection suffered in some parts of the country in the early days of the oral polio vaccine, which was eventually overcome, people trust in the science behind vaccines, which is also considered the most cost-effective intervention in disease prevention. Bearing that in mind, the question is, why these preventable deaths?
One what we need to do right now is to think ahead. Within the next 1 year to 18 months, we should be able to have the capability to produce our own vaccines. Because even if you order vaccines today, you have to wait in the queue because of the demand globally. This should be a priority project to set up a vaccine manufacturing capability in the next 12 to 16 months in Nigeria. So we have a vaccine which is quadrivalent. It covers A, C, W, Y. So why not use that?
The best ones that cover the most serotypes are the most expensive and the ones produced the least globally. There are a very few numbers of companies that actually produce the vaccines. It does produce some level of protection against several serotypes, but no country also has all the serotypes circulating. So there are hard decisions that need to be made. And I think these are conversations that will now come up for discussion.
The sum of $1.2 billion is what the Center for Disease Control says is required to vaccinate 22 million people against the serotype C meningitis in the affected areas. For now, the rains are here, which is expected to bring down the heat in the atmosphere. From the analysis of the director, Nigeria Center for Disease Control, Nigeria's adoption of the 4-in-1 vaccine, which covers even the notorious serotype C, is dependent on global reduction in the cost, as it stands at $100 per dose, a situation which more than ever beckons to Nigeria to explore local production of vaccines. For Dateline 260, this is Rabi Abdullah.
That quadrivalent vaccine currently adopted in Kenya may just be the way out for now. But local production may make more meaning, especially as vaccine procurement, I understand, Rabi, is not an off-the-shelf affair. However, before we look at this aspect of Nigerian content, let's go to Nigeria's northwest, where Mohammed Nasser gives us a situation report on the outbreak so far.
Sokoto State, located at the extreme end of the northwestern part of Nigeria, is among the states worst hit by the new strain of cerebrospinal meningitis. 7 out of the 23 local government areas of the state were worse affected by the epidemic. At the early stage of the outbreak, in 2 days, about 500 infected persons, most of whom were children, were hospitalized at various health facilities across the affected areas. Available records at the State Ministry of Health indicate that 41 persons died from the disease, while hundreds were treated and discharged. This type of cerebrospinal meningitis, which medical experts describe as type C, appears to be more complicated. As you can see, there are still people lying in the hospital receiving treatment as a result of CSM. The medical emergency response teams deployed to all the affected areas for active case search, definition, and management helped in minimizing mortality rate from the epidemic.
We are still having referral cases of complications at the Murtala Specialist Hospital, which is as a referral camp opened. We are managing cases there, and we have zero mortality. We are not having death at the camp there as much as we used to have. And at the villages too, and communities and health facilities across local governments, the teams their capacities have been built to manage cases as they come very early.
Active social mobilization at the grassroots and intersectoral agency collaboration have also helped in creating awareness to people, which also reduced the number of new cases of the disease. Local government subcommittees supervised by royal fathers have also embarked on an enlightenment campaign, creating awareness on preventive measures against the disease. Also in Kebbi State, authorities say 17 cases of the disease were recorded in 14 out of the 21 local government areas of the state, and no death recorded. The holistic approach by government and other stakeholders to tackle the problem of meningitis has helped in ensuring the reduction of number of cases of the disease. In Sokoto, I am Mohammed Nasser reporting for Dateline 360.
Holistic approach, Mohammed, is what's needed for a rare presentation as is currently on in Nigeria, especially in Zamfara State, where about 300 have been confirmed dead and over 4,000 hospitalized in the 14 local government areas of the state. Haliru Muhammad Umar is on standby with an update.
Zamfara State is considered the worst hit by the outbreak of meningitis among the various states where the endemic was reported in the last few weeks. In spite of the measures taken by the state government in collaboration with federal government health institutions as well as development partners to contain the outbreak, the unfortunate situation seems to have continued unabated. Latest statistics from Meningitis Outbreak Emergency Response and Prevention Committee constituted by the state government showed that 2,450 cases were so far reported, out of which 269 were confirmed dead. The number of cases was noticed to come to a decline immediately after the reactive vaccination in Hauwa. Currently, however, there is a second phase of this reactive vaccination ongoing in the most affected wards of the 14 LGA in the state. In addition, new cases are being reported on daily basis, resulting to serious congestions in most of the healthcare centers operating in the state. Apart from vaccination centers for prevention of the endemic, isolation centers for those infected have also been established in various health facilities to prevent the spread of the deadly disease.
This is one of the meningitis patients receiving treatment in one of the health facilities in the Zamfara state. As you can see, it's responding to treatment.
Zamfara State Governor Abdulaziz Yari had visited victims of meningitis in isolation centers established in various health facilities across the state, where he emphasized the need for proper medical attention to the victims. The Minister of Health, Professor Isaac Adewale, Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaibu, and other stakeholders were also in Gusau, the Zamfara State capital, as part of commitment to address the menace.
We must put all hands on deck. The first important and primary responsibility for a leader is to ensure life and property are protected first before any other thing.
So essentially what we are here is to build confidence and assure the Nigerian people that we are on top of this outbreak. This outbreak cannot mar Nigeria. It cannot determine the future of Nigeria. We can determine the outcome of the epidemic. We are on top of it, and we have all the necessary materials to tame the epidemic.
I have no doubt in our minds that we're going to have vaccines. However, it is not just the vaccines that we need. The vaccines can prevent, over the course of the next few days, further infections, further spread of infections. But we have to really go back to the basic principles of public healthcare interventions.
The state has, however, requested the supply of more vaccines to prevent the spread of the disease. The last time Zamfara State experienced a similar outbreak of meningitis was in 2009. In Gusau, I am Halliru Muhammad Umar reporting for Dateline 360.
An experience many wish could be finally brought under control, especially if research and local production of the vaccines, which are critical to the prevention of meningitis, are given priority. And that's according to Uche Nwizu in the next report.
At a health forum in Geneva in 2015, the World Health Organization and some other international public health agencies cautioned against an acute shortage of meningitis C strain vaccine in Africa, where the risk of outbreak is high. And such shortage, they said, will hinder efforts at reducing the number of affected persons.
True to that prediction, less than 2 years, Nigeria is engulfed in an unprecedented outbreak of the NMSC strain 3, leaving one with the question of what the nation has done in area of research for local production of vaccines.
The know-how, the manpower is there. The intellectual ability to develop these things, we have them. The challenge comes with the infrastructural requirements, the enabling environment to then put into practice what you know. I mean, take the issue of vaccines. In the 60s, Nigeria was producing vaccines for some basic ailments.
Logistics in the distribution channel is also another factor identified as a challenge the National Institute for Pharmaceutical Research and Development is faced with and currently addressing through a proposed cell phone-based tracking technology.
Now, with this technology, there's going to be a difference. The product arrives and is distributed to the places that need it, where there is epidemic, where there is emergency, because of two things. One, the technology depends on is the cloud technology, which means you have a vast storage facility in the cloud for information that you need, and you can manage that quickly.
Though experts say it is more economical to import vaccines due to the high cost of production in Nigeria currently, there are other advantages that come with local production of vaccines.
What will be ideal is a public-private partnership. Government should have investment in any industry that will produce vaccine or any medical products. By so doing also, they'll be able to ensure quality of products that are produced to meet international standards. If we have these industries established, any products coming out of the industry here can be exported to ECOWAS countries, as an option.
Right here, Niprisan, which is the widely acknowledged drug for the management of sickle cell disease, like many other drugs, is being produced at the National Institute for Pharmaceutical Research and Development. And from my findings and interaction with the management of this institute, the potentials to locally produce vaccines avail if given the right funding and conducive environments. Uche Nwizu, reporting for Dateline 360.
Need I say more, Uche? Let's leave it there for now and cross over to Nigeria's northeast, specifically Maiduguri, which has all the predisposing factors for the occurrence of CSM at this time of the year. Haman Jabani is our guide.
Most residents of Maiduguri, the Borno State capital, are full of apprehension with the alarming rate of outbreak in most states of the Federation and the number of lives lost going by the intensity of heat currently in the state, which is one of the predisposing factors of getting the disease. In the time of the year like this, when the sun becomes too high in Maiduguri, residents abandon their work and even business activities to allow the weather to cool down, taking rest under trees.
Choose where you sleep for a better condition, a good weather.
People should avoid walking under the sun.
Leaving their windows open for cross ventilation, and then the number of people that sleep in the room should be reduced.
For the IDPs at the camp, although there are no available trees around in some that may cool the weather, others are blazed with trees, and since their tents are well spaced, the question of inadequate ventilation does not even arise. Hauwa, they say prevention is better than cure, and that is what exactly Borno State government and other stakeholders are doing since the cases of meningitis hit the airwaves in some states of the Federation, including Yobe, a neighboring state.
So the government now is vaccinating all these people that have been liberated, that did not have opportunity to be vaccinated in 2012.
That notwithstanding, other NGOs in the state are working with government towards tackling any eventuality.
As UNICEF, including other organizations like WHO, and we have been given a specific task. Like I said, we are doing vaccine management, but also in this particular task force, we are coordinating the communication and awareness function of the task.
Considering the fact that the state shares border with Cameroon, Niger, and Chad, there is the risk of cross-border infection. With no any reported case of meningitis in Borno State, stakeholders are of the belief that for effective prevention of this epidemic, there must be massive campaign, enlightenment and health education by all, most especially by traditional and religious leaders and even the media. So, Hauwa, what are you doing in your neighborhood to prevent this epidemic? For Dateline 360, I'm Hamman Jabani.
sensitization hammered, and with education said to be par, our contribution remains always giving the people power to make informed choices about their health. And still on owning one's health, we asked Abdullahi Garba Brinin Kudu to feel the pulse of the people that matter in this case.
Now that these predictions have been made early enough, adequate steps should be taken through massive publicity, warning people.
Well, this is Mavushi village, very close to the Federal Capital Territory. Looking at the congested environment, one can imagine what will be obtainable elsewhere in the country. This brought to the fore the question that, are people really aware about the precaution measures against this meningitis?
Yes, we are.
So apart from vaccination, what are the other measures you are taking?
Due to the environment, with the nature of the environment we are, the environment itself is so congested that we are in need of, to make expansion of other areas. So though we are into the
medical practitioners and concerned civil society activists with health bias advise for massive awareness with focus on clean environment, safe hygiene, and increased funding to vaccination as a way forward.
It is encouraged that you use your elbow. You want to sneeze, you do this way and cover it. Because when you use your hands, you cough out some organisms. You could use it and touch places, others will touch it. You could use it and shake someone, that person uses it to eat. So through that means it can transmit not just meningitis, but also other forms of health.
Dateline 360, however, takes this issue before Senate Committee Chairman on Primary Health Care and Control of Communicable Diseases.
What it means is that we must be proactive at all times. We must be prepared at all times. First and foremost, we have to strengthen the surveillance capacity of the Center for Disease Control, because as an agency saddled with disease control, especially communicable disease, their responsibility at all times to ensure that they have their radar covering the entire nation as far as disease is concerned. We've agreed that no matter, even though within the lean envelope, Ali will make sure that we release more money or we appropriate more money to health, either the primary health care and Center for Disease Control, so that we can check the spread.
Well, Hauwa, with so many days arising from the outbreak of a rare variant of cerebrospinal meningitis, it is now time, experts say, for all to come together and reappraise the issue of preventive and curative measures against future reoccurrence of the disease. Reporting for Dateline 360, Abdullahi Garba.
Collective responsibility is the key, Abdullahi, at this point. Death can occur in as little as a few hours, and though most people recover from meningitis, permanent disabilities such as brain damage, hearing loss, learning disabilities are likely results of the infection. Reports presented in this edition have raised various issues on the way forward for government and individuals relevant to the subject at hand. The call by experts is for proactive action to nip this preventable calamity in the bud. Send us your comments, questions and suggestions on Dateline 360 at nta.ng or at NTA News Now. And our last word is to embark on aggressive and regular hand washing, critical to maintaining healthy living. We appreciate your company. Many thanks, and bye for now.